How long does surgery take? This is a very common question, and it's also one that's often very challenging to answer. In general, surgery takes as long as it takes for me to do a good job and for me to fix all the problems that we're there to fix safely and effectively. For a first time joint replacement, it typically takes a little bit less than an hour to do the actual operation, from the time we make incision until the time we place a bandage on your skin. However, time spent away from family, from the time that you leave the preoperative area until the time your family gets to meet you and greet you again in recovery, can be as long as 2 or 2.5 hours. This includes the time it takes to get into the operating room, get your anesthetic, receive any medications or nerve blocks that you might require before surgery, and then transfer onto a special operative table built specifically for your operation. We then sterilize your skin with a special preoperative scrub and place on sterile drapes that allow us to do the surgery in a very safe and sterile fashion. After you've been draped, we do the operation, and when the surgery's over, we do everything in reverse. We sterilize your skin again with a special sterile soap, place a sterile bandage and remove those drapes, take you off of the OR table onto a more comfortable bed that we can transfer you into the recovery room area with. Once you're awake and the anesthesiologist are satisfied that you've done well with your surgery, they'll call your family in and allow you to see them. For revision surgeries, it's sometimes much harder to predict. Revisions in general, again, take as long as it takes for me to fix the problems that we're there to fix, both the problems that we've identified before surgery in the setting of a revision operation, the occasional unexpected challenge that we encounter in the OR. In general, my job is to do the best work I can for you, and I don't worry about how long it takes. I care about doing a good job and making sure that you have the best possible outcome. When the surgery is over, I will call your family or meet them in the recovery area and let them know how the operation went, and then the nursing staff in the recovery area or the anesthesiologist will call your family when they're able to see you.